Walk around health and AI is written on every single booth, nearly every single booth. But truly, if AI can make a difference in our lives, a profound difference, it is in genomics.
Yeah, I think this is really a conference where technology and healthcare converge.
Functional precision medicine is the orchestra coming together and playing those notes in harmony perfectly.
Great picture.
And the conductor is AI, making adjustments in near real time based on the environment.
We're spending so much money on healthcare. We're happy to spend $300,000 on a drug, but we can't seem to spend $300 to figure out whether or not that drug is going to work. That math doesn't math, and so
we have so many benefits. We spend millions, tens of millions of dollars on benefits, and we're not seeing the results in our claims data.
While everyone's thinking about the direct to consumer, they're going to have to really start connecting those dots on who are going to be the entities that are most likely to pay for it, why are they going to pay for it, and how does it connect to payers.
This is really important, and I don't want it to not be mentioned. Community. Whenever you have a health condition or a mutation, community is so incredibly important. And there are things that you'll learn from community members that you're not going to learn from doctor offices.
If you empower yourself, and in my life, it's always been a no is a starting point to a yes. Don't confuse your 7 years of going through a medical textbook with my entire life. And I can say that for myself, literally my entire life. My PhD is personal history of the disease.
Damn.
And you cannot tell me that I'm wrong.
you are not going to stop this consumer wave. It is unstoppable.
This is Genetics for Healthcare, a podcast for patients.
I'm here searching for companies and innovators who are on the cutting edge and get the delivery, how important it is to deliver solutions to unlock access, patient access to innovative care, precision medicine with genetic and genomic insights. And I've got Jim Foote here, the CEO of First Ascent Biomedical. Jim, thank you for being a guest on Genetics for Healthcare. We were talking earlier, and the first assay of its kind that identified patients most or least likely to benefit from chemotherapy, there was only one targeted therapy at the time, was a fresh tissue assay where you had to get, cancer cells, live cancer cells, to test against the tumor. Your technology or your approach to precision medicine is called functional precision medicine. Explain what that is.
So the concept of functional precision medicine isn't new. It's been around for decades. It's been in the execution of that's been the challenge. And so basically what we do is we take a biopsy, and we've invented a technology that allows us to rapidly enrich both tumor bulk and chemo-resistant cells, to the point that we can test hundreds of FDA-approved drugs against each cell population and develop a score of which drugs work for you and which drugs don't work for you. We combine that with genomics, we analyze it with AI, and we can produce a report to a physician so that they can guide treatment based on those decisions in about 10 days.
Now, why is that better than just genomics informed only?
The best way I can describe it is, I'll give you a metaphor. We've all been to an orchestra, right? So genomics is like the sheet music. It's the notes that they're supposed to play. Functional precision medicine is the orchestra coming together and playing those notes in harmony perfectly.
Great picture.
And the conductor is AI, making adjustments in near real time based on the environment.
So with this type of technology, how does technology or how does AI even that you mentioned make this affordable, scalable to unlock access for more patients?
Yeah. So AI is finally delivering against all the promises it's been making for decades.
We've been talking about it for forever, but all of a sudden it's here. Right?
And it's here, and it's the AI gold rush. We've been validating our AI engine for nearly a decade.
Okay, wow.
And we've been publishing. But when you look at it now, what used to take us 5 hours, we can now do in 5 minutes with robotics. What used to cost us, a lot amount of money for, we can now do with AI in the cloud for just a few cents. And genomics testing used to cost $10,000. Now it's less than $1,000. And all of those throw off a very rich data set now that we can process in Amazon or Google or one of these clouds very inexpensively.
You guys have a tremendous AI solution to help not only patients make better use of their health benefits, but also you're helping the employers, help self-insured employers, the payers also avoid costly claims that are sometimes unnecessary and burns a lot of, wasteful spending. Help us understand, Gronker, what you guys do as a company and the AI solution that you've developed and why it came about.
So I actually came out of retirement 13 years ago to start this business because I was struggling with my own health. And what I found is that the world at the time of solutions was very much inside baseball, benefits speak, and pushing you off to like, oh, you should try this benefit, you should try that benefit, but not helping anyone in the moment when you actually have a problem.
That is everything. There's not many solutions for healthcare. I mean, we all have health plans, whether you're even Medicare, Medicaid. A lot of times you kind of have to guess how to navigate those.
Exactly. Okay, so this is exactly it. So navigation, totally broken. I keep talking about the death of the directory because the models that have existed were just directory models. But all the directory does, like you go to the mall and you look at the big map outside the mall and you need to know, well, do I want to go to Macy's or do I want to go to Bloomingdale's or whatever? Well, no, I just want to get some tennis shoes. Like I need tennis shoes or I want to be a better runner. For us, what we're seeing with our clients, we're saying to us, look, we have so many benefits. We spend millions, tens of millions of dollars on benefits, and we're not seeing the results in our claims data. We're just not seeing it. How can we help people? And we want to do three things. One, how can you help employees get relief in the moment? How do we know what's working and what isn't? And then how do I lower the burden on my HR team so that I can lower costs as well?
Those are really big problems to fix.
So the first thing that we did is we said, okay, we've been doing this for a while. So we have thousands of evidence-based content, videos, programs, et cetera, across the spectrum of health and well-being. So we said, okay, we're going to use our conversational AI, Grokky. And what Grokky is going to do is let an employee ask any natural language question in any language in the world.
Okay. This is really, really innovative. Okay, I'm sorry.
All right, so no. So someone will say in English, in French, in whatever, Spanish, German, Russian. Okay, my back is hurting me. They don't have to say, I need a benefit. It's just, I have backache. And then what Grokky does is it interprets what that individual may need based upon two things. We ingest all of the benefits the company has, so we're aware of what's in there. And then we have the eligibility information to map one-to-one what each employee might be suited to them. So for prevention, it is all about bespoke precision in the moment. Okay, and we'll say, back pain example, if you were to say, Rome, my back hurts, you're going to get a very different in the moment. Here's what you can do right now. Here's a 60-minute back pain release by exercise physiologist Kevin Fong, who works with the Niners. Go Niners, my team. Not having a great season, not great season.
Better than Cowboys, so.
You're right, sorry. Whoa, whole different topic. So what you're going to get in that moment is specific for you. And then it'll give you in the moment, here's what you can do right now. Plus, here's what you can do next. So think of it now, next, and then a care pathway. And the last piece, that care pathway, that's more like navigation, where we'll say to you, oh, your company, I see that you are eligible for name your MSK solution. And you can then go pursue that, make an appointment, whatever. But you're not going to start with a high acuity intervention. You're not going to go to an ER. You're not going to go see a provider if you don't need it. It'll start you with what in the moment can immediately help you. So what does that do? Burden off the HR team, give you something in the moment, and significantly lower costs.
I'm here with Lior Rauschbarger, the CEO of Gene by Gene here at the world's largest health innovation conference. And you're here as a speaker, and we my audience is all about how do we inform people who are decidedly non-medical, right? Who not only are in the midst of battling diseases,
Yeah.
but those who are looking to be proactive and preventative
Yep.
in diseases, to use genetic and genomic information to not intimidate, but empower themselves.
Yeah.
Tell us about Gene by Gene and what you guys do for your customers.
Well, we have a very large lab, one of the largest in the United States, and we do whole genome sequencing. So whether we like it or not, we all inherited 3 billion letters from our parents, and that's our unique blueprint that makes us all very unique. And so we are taking people's DNA and we are sequencing that for lots of companies and unlocking a lot of secrets of what that DNA means. So really it's about empowerment. It's about democratizing healthcare so that we can arm individuals and their clinicians and their doctors and their dietitians and their trainers with information that they can, live their best self.
What is the potential of where we are now? Because we traveled this journey of genetics and genomics, and I've been fortunate enough to be in the industry of this, what we call precision medicine, for a couple of decades now. But we're just kind of reaching the tipping point to where medical societies are endorsing.
Yeah.
You have, retail aspects of genetics that people can access. But what does Gene by Gene focus on in terms of diseases, and who are your customers that you serve? Because you said there are many labs that will send their tests to you.
Yeah, so we mostly provide services to other companies who provide services to consumers. So we have a really broad church of customers, from genealogical customers to ancestry to healthcare networks to obstetricians and gynecologists to cardiologists. Cancer is a very large area as well. And the reason we're at a very exciting inflection point now, it's a lot about price. When we've been in the game for 20 years, 20 years ago, for me to do a whole genome test, it cost literally about $10 million. That's nearly down to $100 today.
Yes.
So it's been a rapid decline, which is fueling research, and it's making it so much more accessible for everyone. And we're learning so much about ourselves. So my vision is that everyone that's born, the day they're born, should have a whole genome sequence, and that's their own data. They carry that for their entire lives. And they share that, their data, and they share that with whoever they want at different points throughout their life.
So what's the potential if we can do whole genome sequencing at birth? What is the potential in terms of improving healthcare and the ever-present, growing debt of medical, healthcare?
Yeah.
How will that improve the cost of care?
I think at the moment, all the costs are in their last 5 years of life. Yeah, when people already have had a stroke or a heart attack or a disease, it's a little bit too late. I mean, we can still do a lot, and genomics can help make a diagnosis and talk about prognosis, but I really want to shift it much further upstream into prevention. So if we can know earlier on that people are at risk of certain things before they acquire those diseases, we can proactively treat them and monitor them and nudge them and encourage them to improve and make better life choices, we'll save the system hundreds of billions of dollars. Yeah, literally.
So with cancer, this is where a lot of the demand and utility has been with genetics and genomics, not only in the treatment, getting patients into clinical trials, but now for prevention.
Yeah.
Right. For further generations. What other areas do you see genetics and genomics making that type of impact on a disease?
Yeah, I also think there's a lot, because the prices dropped so much, like we talked about, just population health research.
Yes.
There's so many conditions that we don't know exactly the root cause. We don't know how to treat them, right? I mean, it's infinite. All these autoimmune conditions, diabetes, even things like allergies and whatnot. So if we can do larger and larger studies because the costs are so much more reduced, we're going to unpack all these elements about what the root cause is, how to monitor it, how to manage it. So I really want to see much larger studies, which will be a lot more affordable to do, which will then, the amount of the research that we can do and the findings and the insights are going to grow exponentially. It's very exciting.
We're at a key time where we're able to accelerate this with the use of technology. So we're at health. Everything is health technology here. How do you see this playing a role into accelerating access? And then what's possible thinking, 5-10 years down the road?
Absolutely. Well, you walk around health and AI is written on every single booth, nearly every single booth. But truly, if AI can make a difference in our lives, a profound difference, it is in genomics. Because each, if I have to grab your DNA, Rome, that'd be a 60 gig file. That's a lot of data. That's one human being's genome. So there's a lot of combinations and permutations. So we're going to need computer codes and machine learning and AI to unlock all the patterns, all the pattern recognition, to all the advanced mathematics, so that we can learn what all these genes mean. Because I think today we probably only understand what 0.5% of those genes mean. So we've still got 99% to learn from. So I do think AI and that we're reducing cost of AI and the reducing cost of doing genomics, those put together is going to be an amazing catalyst for the next 5 to 10 years of precision medicine, right? At the moment, we treat everyone one size fits all. Yeah. And we need to move to a world that's hyper-personalized.
You just found that you had a BRCA variant. Your story, and I honor you for sharing your story, just how powerful this could be, because I grew up in a house where you don't go outside this house to talk about our business, right?
I know.
But as a result of that, we didn't know our family health history either.
Yeah.
Right. And so even in your situation, your story being, a foster child and not necessarily having that connection, knowing that you have the BRCA2 variant can be empowering in future generations going forward, so they can be aware of that, be more attentive to screening, and have the option to take measures to prevent a cancer diagnosis from happening, as you've been talking about. So what are a couple of tips that you would give to folks listening? Because our audience are, non-medical people.
Right.
What are a couple of tips that you would give them with respect to managing diabetes? And I mean, I'm just so enthralled into that idea of epigenetics and the effect that it has, the generational trauma and how it's handed down. How would you share tips or advice to manage that for better health?
So I'm a former classroom teacher. I didn't share that with you. I taught English and I was a cheer coach in Texas. So if y'all know anything about Texas and football and cheer.
I live in Dallas, Texas, but trust me, we have it.
5 years.
Yes.
Okay. So education is always going to be my first tip. The more you know is always going to be better, and what you choose to do with that is your responsibility, but it's your responsibility to know what you do and don't know, right? And it's okay to ask the silly questions. It's okay to look foolish in pursuit of that knowledge,
Right.
But pursuing the knowledge is the most important thing. Alongside of that, the second thing I would say is the awareness. Right. And so how can you raise awareness not only within yourself, but in those around you? So those who are biologically connected to you, they're going to hold information about your health and wellness, whether or not you realize it, like it or not.
Yeah.
And you're going to have information that's going to be helpful for them too. So having those conversations, even outside of your nuclear family, is incredibly important, especially when we look at genetic mutations in particular. Because had I not had this conversation, I think it was one of my great aunts, I wouldn't have known that all my aunts died from breast cancer.
Yeah.
You don't see that kind of stuff on ancestry.com,
No.
and there's not a lot of people alive who are willing to just volunteer that information to me. So having conversations and facilitating and creating that awareness, not only externally, but internally too. Awareness changes the world. I'm telling you, if everyone was aware, we would have so much more happiness and joy and less
It
conflict.
would be certainly a better world, and we'd be a lot more transparent with each other.
Yes. And then I would say the third and final thing would be reclamation. Like, reclaim your health and wellness for yourself. Find joy in taking care of yourself. Don't force yourself into things that don't make sense for you. And so I'll give you an example. Exercise is a really important part of the way that I manage my diabetes. But I realize I can't do exercise if I'm not enjoying the exercise. Right. And so if I'm going to weight train, I have to find ways to engage in weight training that are sustainable, that bring me joy. If I'm going to do cardio, it needs to be something that I like and that I can do every single day, and not something that is a task, that something that I hate, something that breeds resentment towards my body and exercise itself. So find ways to enjoy taking care of yourself. Find ways to enjoy engaging with healthy nutrition and diets. Find something that works for you. What works for me might not work for you, and vice versa. And can I add another one?
Absolutely.
This is really important, and I don't want it to not be mentioned. Community. whenever you have a health condition or a mutation, community is so incredibly important. And there are things that you'll learn from community members that you're not going to learn from doctor offices. You're not going to learn from documentaries. You're not going to learn from consultants or RNs. You're going to need to talk to people who live with this every single day, who can share their experiences, and you can share your experiences. And honestly, y'all help each other out way more sometimes than the professionals. And so community, I think, is potentially the most important part of all of this.
This is Genetics for Healthcare, a podcast for patients.